COVID-19 virus is hitting minority populations in Illinois particularly hard, especially in Chicago. Data shows Latinos now make up the largest portion of any reported demographic of confirmed cases across the state. But African Americans are dying at proportionately higher rates as well. As of early May, they make up just 30% of Chicago's population, but about half of the city's more than 1,000 coronavirus deaths. ProPublica sought to explore the problem by examining the first 100 recorded deaths in Chicago. The vast majority of them were black. And joining us now to talk about that investigation is Dua El-Deeb, a reporter with ProPublica, one of 7 who looked into these inequalities. And Dua, I have to tell you, it's a very powerful report because we see the numbers every day, but when you learn the backstories of these people you were able to trace to find out more about how they died, it's heartbreaking. And part of it is the powerful connection that they shared with the city and their family and their friends, and it's part of what makes this virus so devastating.
Absolutely. It's so heartbreaking when you hear their stories and you talk to their families and they tell you how these were doting uncles and grandmothers and nurses and respiratory therapists, and there are people who not only had such a strong connection to their families but to the communities themselves.
What are some of the commonalities, the things common that you found? I mean, we know a lot of it has to do with underlying conditions, but there's some other things, social things.
Right. So unfortunately, a lot of this goes back to this legacy of racism in our country and the disinvestment in the communities, especially on the south and west side. And most of the people of the first 100 lived in segregated communities where they had a low annual median income, where a lot of the people were already sick. They had hypertension and diabetes and asthma. But more than that, what was really striking about the reporting as we did it was that a lot of them lived in neighborhoods where they did not trust the hospitals that were down the street from them.
Why is that?
Well, one of the family members that we talked to said that there was 2 hospitals within 5 minutes of this one man's house, but he just felt like he wasn't going to get adequate care. A lot of these hospitals are what are called safety net hospitals, and so they don't have a lot of private insurance patients, and so they don't have as much resources financially, and they're not as well equipped.
The other thing that was really hard to see and to hear was that so many of them waited until it was too late to get help.
Yeah, that was devastating, and part of that goes back to the guidance. So, one of the families we spoke to talked about how, when he started feeling sick, he called his doctor, and his doctor told him, what the CDC recommends, what, everyone has heard, which is, if your symptoms are mild, stay home, self-quarantine, but that does not take into account the life expectancy gap, the higher rate of comorbidities and underlying health conditions, and just this overall mistrust in a lot of these communities because of exploitation in the healthcare system.
Dua, this is a great article, but I have to say, this is a long-running tradition in the African-American communities and the Latino communities. So this is really nothing new. It's the pandemic is now just shining a light on it. And as Lori Lightfoot says, and Governor Pritzker says, Mayor and the governor both said, this is not going to change right away just because of this pandemic.
Well, you're right in that it's not surprising. Unfortunately, this is kind of underscoring what we have known and what this country has known for so long. But with COVID, what it's done is it's really showed us what the fatal consequences of those policies have been. And so, right, we can't solve, systematic racism overnight, but some of the other issues that we found in the story, especially related to, the hospitals and the guidance, those things, I think there is a potential to make a difference.
Well, yeah, as you quoted one of the doctors in the article, every natural disaster will reveal the social fault lines that decide in some ways who lives and who dies. And in this country, that often falls at the intersection of race and health.
That's exactly right. And that's what I think makes this so heartbreaking, because the families that we spoke to, for them, this wasn't something that was inevitable. And I don't think for anybody, we should see this and dismiss it based on some underlying health conditions. But for these families and for the, people that are being taken by COVID each and every day, these are families and actual people, and we need to do something about whatever we can do to mitigate and to try to help and support these families and these communities.
Well, it really is an impressive story and great reporting. Dua El-Deeb, thank you very much for your work and your colleagues as well.
Thank you.